Good evening, everybody, and welcome to this NANOS webinar, Demystifying Careers in Neuro-Ophthalmology. What is it that we do? I'm neuro-ophthalmologist Orife Adeshina, and I'm excited to welcome you as one of your co-moderators tonight, along with my colleagues and friends, Doctors Nalin Razul and Amy Sweka. Neuro-ophthalmology is a fascinating specialty that bridges the worlds of neurology and ophthalmology. With over half of the brain's pathways connected to vision, our field is dedicated to understanding how nervous system diseases impact eyesight and treating patients with these often complex but fascinating conditions. Whether you're familiar with neuro-ophthalmology or just hearing about it for the first time, you may have some questions or even misconceptions about what we do based on your level of exposure to our field.
Well, that's where this webinar comes in. Tonight, we're here to share our personal stories, experiences, and insights about this dynamic and diverse field with the goal of sparking your curiosity, debunking myths, and highlighting the critical role neuro-ophthalmology plays in patient care and the broader medical community. We've assembled a fantastic and diverse panel of neuro-ophthalmologists and individuals who are passionate about this specialty. And together, we'll explore why we love what we do, the value neuro-ophthalmology brings to our patients and colleagues, and for trainees, how you can get involved and pursue a career in this exciting field. As a reminder, we have a survey that we would love for you to fill out. The QR code will be at the end of our presentation, and it will offer the opportunity to be connected with a neuro-ophthalmology mentor as well. Thank you for joining us, and let's get started.
Hi, everyone. I'm so excited to introduce our first set of speakers to talk to us about the value of neuro-ophthalmology. Dr. Peter Quiros, a neuro-ophthalmologist at the Duane Eye Institute at UCLA and the current president of the North American Neuro-Ophthalmology Society, and Dr. Heather Moss, a neuro-ophthalmologist at Stanford University and the president-elect of the North American Neuro-Ophthalmology Society. Dr. Quiros and Dr. Moss, thank you for joining us and getting us started.
Thank you, Dr. Sweka, and thank you for that introduction. Appreciate it. As Dr. Sweka mentioned, I am an ophthalmologist, ophthalmology trained here at UCLA at both the Stein and Doheny Eye Institutes, and I'm the current president of the North American Ophthalmology Society, and I'm joined by my colleague, Dr. Heather Moss, who's also a dear friend.
You'll find that this is all a mutual admiration society because we love each other so much. So I'm Heather Moss. I'm a neurology trained neuro-ophthalmologist at Stanford, where I do outpatient care, research, and some administrative stuff. And as Dr. Sweka mentioned, I'm the president-elect of NANOS. So Peter, why did you choose neuro-ophthalmology?
That's a really good question, Heather. And honestly, it was, to me, by far the most fascinating aspect of ophthalmology in residency training. I quickly learned in ophthalmology that ophthalmology is a very visual specialty, and a lot of it was visual pattern recognition. And I really liked the fact that in neuro-ophthalmology, it wasn't just what you saw, you had to do a little more digging, right? There were a lot of mysteries in neuro-ophthalmology, and I really liked having to be the detective that got to figure out that mystery. And along with there being mysteries, everything was always different. It wasn't always, it wasn't the same diagnosis walking through the door day after day, or a slew of the same thing happening over and over again. So the variety of ophthalmology was really impressive. And then I think one of the things that also influenced me was, when we go into when ophthalmologists go into ophthalmology, it's because we want to do medicine and surgery. And both of my mentors at USC, who are the ophthalmologists that I worked with when I was a resident, both of them were ophthalmology trained, and both of them were surgeons, and both of them did surgery on a weekly basis. And so I was very happy to see that I wasn't going to give up any surgery by becoming an ophthalmologist. Quite the opposite. I was going to get to also treat a lot of the patients that came through my clinic after I had solved that mystery. So it really checked all the boxes for me when it came to what specialty I was going to choose. What about you, Dr. Moss? Because you came at it from a different point of view.
Yeah, so I actually realized in medical school that I did not want to do surgery, and that's one of the reasons I ended up in neurology. But I did love the puzzles, and so clinical neurology to me is solving puzzles. It has a lot of great diagnostic technology, which as a former engineer I thought was really cool. I thought there was so much unknown to learn that there would be leaps and bounds within my lifetime. And I really like the longitudinal relationship with patients. I actually, when I went into neurology, had very little idea about neuro-ophthalmology. I wanted to be a stroke neurologist. But then I got to residency and had the sort of fortuitous good luck to have Steve Galetta, who's one of the panelists on this call, to be my residency director. And then I learned about neuro-ophthalmology, and I realized what the ophthalmologists already knew, which is that the visual system is super cool. It basically covers all of neurology, all of neurosurgery, and people really care about it. So the patients are really engaged about their vision. And because it affects so many things, there's just wonderful opportunities for collaboration, both in the clinical space and scientifically, and it really has a dramatic impact on people's lives. And so that's why I chose it. And the great news is that I still like it. I'm 15 years into my career, and I still think vision is cool. I still like collaborating with all of my colleagues. I like solving the mysteries. What I didn't anticipate, but has also made it really great, is that there's lifelong learning. And so, MOG was described during my career, and we're just constantly learning. It's a community of people who love to learn. And so it's not the same old thing every day. And that is super fun. The other thing I didn't anticipate when I chose neuro-ophthalmology, which has been wonderful, is the community. So we're a small subspecialty. One estimate is that there's about 400 full-time equivalents in neuro-ophthalmology. So that's all there is that's focused on the afferent visual pathway and eye movement disorders. And within that, NANOS is our professional society, and it's a very accessible number of people. So everyone is so helpful to, support us compared to my friends in other bigger subspecialties. I felt from the moment I set foot in NANOS, everyone wanted to be welcoming. And so there is lots of opportunity, even when you're a young person, to really get involved, meet people. You aren't sort of having to bide your time. How about you, Peter? Do you still like being a neuro-ophthalmologist?
I I think the fact that I'm president of the North American Ophthalmology Society should probably tell everybody here that I am very happy that I made this choice as ophthalmology. And honestly, it's exceeded my expectations. There's still a mystery around every corner. There is still something fascinating that walks through the door. Three very fascinating things walked in through the door today. And I'm still doing surgery. And one of the things is that it's evolved, right? Everything has evolved, and our surgical techniques have evolved, even in strabismus surgery. And we've evolved in the way we diagnose things. We've even evolved to have treatments for some of the diseases that weren't treatable before. So I think it has exceeded my expectations, and I really like seeing when I had a med student shadowing me, our UCLA med students shadowing me today, and it was really great when she basically made a bunch of connections to what she'd been learning earlier in the day in her neuroanatomy section. So it was really, I was really impressed to see her make those connections. And so those are a lot of the things that happen. And I'm really glad that you mentioned NANOS, because NANOS actually, I think, provides a lot of opportunities now for trainees of all sorts, medical students, residents, and fellows, to really get engaged in neuro-ophthalmology and in the neuro-ophthalmic community. I was actually surprised at how relatively small the neuro-ophthalmology community is. And if you've been in it long enough, you end up sort of knowing everybody. And that's actually a really nice thing, because you know who you can talk to about certain things, you know who you can, discuss new ideas with, you know who you could go to if you have a really complex case. It's something that's really nice that I don't know that you have in other specialties. I wouldn't know, because I'm not in another specialty, but I think that it's something that I think is probably very unique to us because of the fact that we're a smaller community. And one of the nice things about that is that we have room for expansion.
And then for the people who are on this call, I notice actually many of our colleagues are attending the webinar, so they don't need this information. But for those who aren't yet neuro-ophthalmologists, are there opportunities for them to get involved in NANOS?
There are plenty of opportunities for everyone to get involved in NANOS. We now have medical student memberships as well as resident and fellow memberships. They can participate in many of the activities and both research and some of the and social aspects as well of the communities. And we also have a young neuro-ophthalmologist group, the YONO group, who plans both learning and social activities for all trainees, and so there's plenty of opportunities to get involved. And if anybody, we would love to see you get involved in spreading the gospel, so to speak, of neuro-ophthalmology, and just go to our website, nanosweb.org, and you'll see many of the educational and participatory opportunities that are available to you there.
And as the chair of the this year's NANOS meeting, which is in March in Tucson, and next year's 2026 NANOS meeting, which is in March in Boston, I just want to give a plug that the meeting is extremely friendly to medical students, residents, and fellows. We have a poster session that people come to because we serve food and drink. And so you can submit an abstract, you can meet people. The different courses are for all levels of learning, and it's a really good time. I think a lot of people who went into neuro-ophthalmology were thinking about it and then went to the meeting and fell for it hook, line, and sinker. Yeah. So please join us.
Some folks joke that the meeting is the gateway drug to neuro-ophthalmology, and I would agree.
All right. Well, that's it for the opening act. So we'll pass you back to your webinar leaders. Dr. Rasul?
Well, thank you so much. Thank you so much, Dr. Moss and Dr. Quiros, for a wonderful introduction. So to segue us a little bit into the next round, I'm absolutely thrilled to introduce two residents that are interested in neuro-ophthalmology. The first is Rel Naj. He's an ophthalmology resident at UCSF. And the second is Carly Papo, and she is a neurology resident at UCSD. And so I'm going to let both of you take it from here.
Hi, everyone. I'm Aurel. Nice to meet you. And then I'm joined here by Carly. And we're just going to go ahead and dive right into it. And I feel like one way to do it is, Carly, can you tell me what's the most important thing that for you as a resident drove you to decide you wanted to become a neuro-ophthalmologist?
Yeah, so we put together a slide with some advice on what to do if you think you might be interested. And I'll highlight some of our key points. For me as a medical student, I attended the American Academy of Neurology conference after I matched into neurology. And it was there that I met Dr. Newman and Dr. Buse, who were just so inspiring and so upbeat. So I went up and talked to them after one of their presentations, and they advised me that I should seek out as many opportunities as I could find in neuro-op if I thought I might be at all interested. So they told me about NANOS, which I was able to attend as a PGY2 resident. Attending NANOS, as the others have just said, is kind of like a gateway drug. It's probably the best thing you can do if you're interested in neuro-ophthalmology. I especially enjoyed the resident networking event that they have. And then there's also these YONOS breakfasts where you can chat with different neuro-op attendings and learn about their career paths. And then actually through the connections that I made at this conference, I was able to organize an away rotation in neuro-op as a PGY3. So for background, my institution has probably a less robust neuro-op department than other places. So I really had to be more proactive in networking and piecing together my educational opportunities. But in the end, the away was really pivotal in my decision. It introduced me to wonderful mentors and showed me the complexity of neuro-op, gave me the confidence I needed to commit to it 100%. So Aurel, what about you? What was sort of the most important thing that led you towards neuro-op?
Yeah, so I feel like one of the points you touched on for me holds really true as well, which is just the mentorship and kind of the excitement that neuro-op mentors, neuro-ophthalmologists in general take towards seeing fresh people coming into the field or helping nurture careers is just unrivaled. I've never really seen another medical specialty where people are just so excited to work with you as someone who is, potentially interested in neuro-op. So that's really inspiring, and I think really meant a lot to me. My path was a little different, actually. Even before med school, or right about at the beginning of med school, in the end of undergrad, I've always been very research focused. I did a basic science PhD in neuroscience, studying memory and the visual system. And one of my first classes as an undergraduate was just basic neuroscience. And the class started off talking about, ocular dominance columns and color perception and how that's in a different place in the brain than motion perception. And it just kind of blew me away and was the thing that I locked into kind of for the rest of undergraduate as the thing I wanted to understand better. Is how do we take what we see and do all the cool things that make us human with that information? It's just too interesting. And I was fortunate enough to have a neuro-op department in the place where I did medical school. And so pretty early on, I found the neuro-ophthalmology mentor, Eric Geyer, over at Harvard, Boston Children's, who allowed me to shadow him in clinic. So even as a med student, I was already kind of seeing what neuro-op was like. I was trying to do strab measurements, which I'm still working on. And we got to do some basic imaging research together as well, which again just ties back to this theme that neuro-ophthalmologists are just so excited to work with you. It's such a burgeoning field, I think, and with such strong mentorship and support. The science is just so cool. There's so many bleeding edge technologies, gene therapy for optic neuropathies. No matter kind of what background you're coming into it with, there's some niche that you can find that you can kind of make your own and nurture. And I think that's just really, really exciting. And kind of along that subject, I'm an ophthalmology resident and Carly's a neurology resident. And so it's interesting to think about too, within those specialties, there are so many ways you can subspecialize. What I guess draws each of us within our specialty to neuro-op specifically is a little different. And I'm kind of curious, Carly, as a neurologist, what about the neuro-op career path draws you to it specifically over other subspecialties in neuro?
Yeah, so I'm choosing neuro-op for three main reasons. The first is really the content. It's the most interesting cases I've seen as a neurology resident have all been within neuro-ophthalmology. I've found that neuro-ophthalmologists enjoy a challenge. They're experts in investigation and diagnosis, and they enjoy collaborating with other subspecialties. So not just within neurology or ophthalmology, but neurosurgery, rheumatology, oncology. And I really enjoy that multidisciplinary approach. The second reason is that neurology can be a very subjective field, and I have appreciated having some more pieces of objective data that can help inform my differential diagnosis. So not just my neuro exam and MRIs, but also adding now the eye exam, visual fields, OCTs, et cetera. And then lastly, the third reason, I've personally always wanted to be a clinician educator and pursue a career in academic medicine. And I think this field will support those career goals very well. So Arl, what about you? Why would an ophthalmologist consider neuro-op and what draws you to it?
Yeah, so I chose ophthalmology because I wanted to kind of get my hands in there and actually treat patients and, do something physical to help make their lives better. And I really like that iterative process of working at a physical skill, making it better and better. I like to think of ophthalmology almost as being the jeweler of the human body. I think there's a really nice analog there in a lot of ways. But ophthalmology can also be very insular. As you get deeper and deeper into sub pieces of the eye, you get further and further away from the rest of the body. There's a reason people joke that sometimes ophthalmologists are like dentists of the eye. And neuro-ophthalmology very much is an exception to that, I think. A lot of the pathologies in ophthalmology that are dreaded, that are life-threatening, that really can change a patient's quality of life beyond just how well they see, basically almost all fall into neuro-ophthalmology. And there's a big part of that to me is really inspiring and exciting. I want the work that I do to, help patients in all sorts of ways, not just helping them see, but also, helping them actually continue to live their lives the way they want to. And so the thing you mentioned as well about kind of cross discipline interactions with other specialties holds really true as well. Consult service for ophthalmology is notorious. We have a lot of kind of junk because people are so afraid of the eye. And then we get these consults from neuro-ophthalmology cases that are neurosurgery, neuro-oncology, rheumatology, neurology, infectious disease all at once. And everyone is so focused on their little bit. Nobody's really looking out for the patient in the big picture. And I've run into so many situations now where as the neuro-ophthalmology consultant in that whole big scheme of teams where nobody's talking to everybody at the same time, the neuro-ophthalmologist is the one who kind of synthesizes it and says, hey, did you guys think about this? And that's kind of the big aha moment that changes the patient's care. So I just love that. I think that's so interesting. And no other subspecialty in ophthalmology does that.
Great. So I think we wanted to touch a little bit on the application process next. Neither of us have quite gone through that yet because we're both PGY3, so we'll be applying this summer. But RL, could you explain a little bit about the app and what the timeline looks like?
For sure. So for the ophthalmology trained folks, you're already familiar with this process. It's called the SF match, which is in parallel to the more standard match for the other residencies that folks have used. Basically, for ophthalmology trained folks, you kind of decide by the middle to end of PGY3 what subspecialty you want to apply to, because applications open right in the summer that sort of precedes the start of PGY4. And you've got many months. You've got basically until early fall to get your applications in, get everything ready, and then you start to interview in the fall with programs and you submit your rank list in December. And then the results are thankfully released about a week after you've submitted your rank list, so you figure out where you match, and then you've got another 6 months to finish PGY4 before you start fellowship in July. Most of the ACGME credited ophtho and neuro residency programs are acceptable, but there can be certain niche backgrounds that if you are part of, for example, a lot of international folks may have to reach out to fellowship specifically to get a little more information, just because it isn't such a common fellowship to apply to. So what about for neuro? How does that differ from your colleagues? Because I'm in sync with all the ophthalmologists. We all apply to fellowship at the same time.
Yeah, so it's a little bit different for neurologists. Our fellowship applications occur at various times throughout your PGY3 year. And actually, all of my neurology co-residents have already finished interviewing at this point. Most of them even know where they're going to be for fellowship. So that could be seen as one potential barrier for neurologists. You have to kind of seek out experiences in neuro-op a bit earlier and kind of come to your decision by probably fall of PGY3, even though the app won't open for you until summer of PGY4. And then lastly, we have one last question left. If you could take everything that we've talked about so far, RL, and sum it up, what would be your key piece of advice for interested trainees on how to increase their exposure to neuro-op?
Yeah, so I cannot emphasize enough, and again, I feel like I'm hammering the point home, is people in neuro-op are so excited to talk to you if you are even remotely excited in neuro-op as a young medical trainee. Any stage of training doesn't matter. They would love to talk to you. So don't be scared to just cold email. If you don't get a response, give it a week or two, send another cold email. Guarantee that someone will reach out to you and respond and give you an opportunity to meet them, to learn about their work, to shadow, collaborate, really any of the above. And through them, you can attend these conferences, as everyone else has already mentioned. NANOS is super fun. It's incredible. I also had the privilege of attending it last year for the first time, actually, but highly, highly recommend. And you just meet everybody because the field's just not that big at the end of the day. So reach out to people if you're interested. That's it.
Great. Thank you.
Thank you so much, Drs. Papo and Nagy, for your wonderful summarizing of this. I'm going to transition us to our next topic. I'm excited to invite back Dr. Heather Moss, a neuro-ophthalmologist and fellowship director at Stanford, and Dr. John Chen, a neuro-ophthalmologist and fellowship director at Mayo Clinic, Rochester. They're going to talk to us today about fellowship training and to expand further on the match process. Drs. Moss and Chen, take it away.
Great. Well, thanks for having us here. So we just thought Heather and I would just kind of chat about this process. And I'll just start off by asking Heather a question. Heather, how do you advise trainees on what neuro-ophthalmology fellowship programs to apply to?
Yeah, I think there's a lot of angst in the application process. And thank you, Oral and Carly, for presenting it in such a calm manner. Maybe you've been practicing, but I think thankfully, you've already been through residency application by the time you apply to fellowship. So it's probably pretty similar. There's about over 30 neuro-ophthalmology programs. There are piles of programs. They're the same in that, they all have great, wonderful expert neuro-ophthalmologists who are really excited to work with you, but they're also all very different. Some of them have differences in terms of faculty expertise, the surgical experience, opportunities for research, obviously where they are, And then there's also some differences in terms of eligibility that's driven sometimes by our institutions, in terms of whether someone can have international residency training or someone have international medical school training. And there's lots of guidelines on the SF Match website, also on our novel page, the North American or the Neuro-Ophthalmology Virtual Education Library. There's information about each program, but I think my number one advice to you is if you have a question, just ask. So if it's not clear if you're eligible for a program or you want to know what the surgical experience is, just reach out and ask the fellowship directors. We want to help you find the right program, just like we want to help ourselves find the right fellow. So John, sort of playing off of that, what are some of the options you've seen for residents who want sort of certain exposure to things like other specialties or research or surgery?
Yeah, again, there's a large range of programs. Some are purely medical, some have a good amount of surgery, some are more geared toward research. And again, this variety of programs actually is nice because it allows the applicant to find that perfect fit for them. It really kind of depends on their goals. So again, some neuro-ophthalmology fellowship pair with strabismus surgery. And so if you're an ophthalmology resident who wants to practice strabismus surgery after you finish, you want to seek out those fellowships that have a good amount of strabismus surgery, and you can talk to you about how many numbers do you expect their fellows to graduate with. Some programs even have orbital surgery as part of their surgical training. And so you're not only doing neuro-ophthalmology, the medical neuro-ophthalmology part, diagnosing the orbital tumor, but you're actually in there with your attending, taking a biopsy of that orbital tumor and making the diagnosis there and then. Your patient with IH, with fulminant IH, you're in there actually making an optic nerve sheath fenestration. And again, there's a large variety of fellowships, and some trainees, even if you're ophthalmology trained, don't want to do orbit, then you would choose not to do those programs. And so the fact that there's a large variety, some purely medical, some surgical, some more research heavy, there's essentially a home for everyone, which is really nice. I like that variety. And so, Heather, we talked about some of these surgical options, some of these other options as well. Does the decision of what programs to apply to match, does it matter if you're ophthalmology or neurology trained for residency?
Yeah, I would say in terms of applications, I would encourage you to apply broadly. And there's a few reasons for that. One is you might even not know that you're excited about something until you see it. The other reason is that as you apply and interview at these programs, you'll meet all of the people who are going to be your future colleagues, both your fellow applicants and also the faculty that you're interviewing with. And then you can really make a good decision. So applying, I would say, apply broadly unless there's something you absolutely wouldn't do. You'll also find that, there may be some flexibility in things. So even if a program advertises that they do surgery and you're a neurologist and thinking, oh, they'll never want me, like they might, because there may be a lot of ophthalmology residents who want that surgery too, and they're quite happy that you want to do medical neuro-ophthalmology. Matching or sort of finding your fit, I think, is a bit of a different question. So after you get all the information, how do you decide? There's this fascinating book called Who Gets What and Why by the guy who's an economist at Stanford who wrote the match algorithm for the National Resident Matching Program, Couples Match. And it talks about why matches happen. And it's very daunting because I think everyone thinks that there's some way to game it. And there's really not any way to game it. So you look at all the options that you have and you decide like, okay, if I could choose any of these, where would I go? And that's your number one choice. And the match is designed to advantage the applicant. So if the number one choice wanted you, then you will get that spot. And so then then you go down your list. And so then it's really a matter of figuring out, well, what am I looking for in my training? I'm listing all these pop culture books. There's another interesting book by Malcolm Gladwell called Blink. And the general thesis is that when you have a complex decision to make, you can write down all the pros and cons, which is what I tried to do, or you can just kind of blink and go with your gut. But some of the things you might want to think about, is what is your experience? So as a neurologist, for example, like the slit lamp terrified me. And my co-fellow, who was an ophthalmologist, like she was terrified by MRI sequences. So I thought it was really cool that I was in a program where I had exposure to people who are ophthalmology trained and I could ask my dumb slit lamp questions too, because I certainly didn't want to ask my attendings. I was in a program that had both neurology and ophthalmology exposure. And, being in the ophthalmology, it's just a totally different world, and it's one that's good to be comfortable with. But on the other hand, I think you will get great clinical training no matter what department your faculty mentors sit in. So a lot of it depends on where you think you'll end up in the world, what things you want to learn, and again, just finding the best fit for you. So John, thinking of this, do you have to do it all in fellowship? Do people do 2 fellowships? Do they do other kinds of training? How do you become the best neuro-ophthalmologist you can be?
No, that's a good question. I'd say the majority of people do 1 fellowship. And again, I think most places, if you want to do surgery, you get a lot of strabismus surgery, and you're going to be able to do good strabismus surgery and neuro-ophthalmology at the same time. Or if you wanted to have a variety of other practices, whether it's neurology or ophthalmology, the neuro-ophthalmology fellowship is enough. But there are certainly some people that do 2 fellowships. For instance, if you want to do pediatrics, if you like pediatric a lot, some people would do neuro-ophthalmology and a pediatric fellowship, and then specialize in pediatric neuro-ophthalmology. Some do a combination of neuro-ophthalmology and oculoplastics and kind of merge it that way, where, again, there's some that will just do the 1-year fellowship and do both orbit and neuro-ophthalmology. But again, some will do both. And from a neurology standpoint, there's some fellowships that often can get paired. One is headache or MS fellowships. They tend to blend pretty well with neuro-ophthalmology because of the diseases we see. There's some that overlap. Get back to ophthalmology, and there's rare people who do medical retina, again, because it pairs pretty nicely with neuro-ophthalmology. But just a neuro-ophthalmology fellowship alone is usually all it takes. It is a very, very broad field, covers multiple specialties in both neurology and ophthalmology. It's one of those things where every single patient is different, every single day is different, and it keeps you very well-rounded. I could actually probably take the ophthalmology boards right now and actually be able to pass, because I'm diagnosing retina disease and cornea disease. It's essentially the clinic of unexplained vision loss. So you're really seeing it all. And really, it's just 1 neuro-ophthalmology fellowship is all you need. And of course, you learn as you're on the job, you learn as you grow, you learn from your colleagues. So it's a wonderful field. But yes, you can do extra fellowships, but I'd say that's probably more on the minority side. So Heather, we talked about how we recently transitioned to this match system for neuro-ophthalmology fellowship. Could you discuss the benefits of the match and why we transitioned that way?
Certainly. So I'll give a little perspective of the way it used to be. Caused a little bit of trauma for some people here and there. But it used to be like applying for a normal job. So the applicants would find out that there were spots, and they would contact the fellowship director to apply. But it sometimes ended up being a bit of an arms race. Some of the prominent programs would sign people up, 3 years in advance. And some of us used to joke that if you didn't know you were a neuro-ophthalmologist to be coming out of the womb, you might not get your pick of fellowships. And it also put the applicants and the fellowship directors in kind of a tough position, because you would interview someone and you had to sort of immediately assess, oh, do I want to offer this person a spot because I might lose them? Or from the applicant perspective, they're like, oh, I'm offered a spot, but I have 5 other interviews lined up and I haven't even looked at those programs. And so it was really just kind of tricky. It was hard for applicants to figure out which programs still had spots or not. And so this was an ongoing conversation, and the fellowship directors as a group decided that we would try the match. There was a lot of discussion about the timing of the match, as Carly and Oral were talking about. They're different for neurology and ophthalmology residents, and we're part of the ophthalmology fellowship match. That does not mean we don't welcome neurologists. It's just where we live in the SF match. And so the advantages of the match is it's sort of one-stop shopping. It allows the trainees a way to see all the programs, to sort of apply uniformly. From our perspective too, I really like it because we're not doing these piecemeal interviews along the way. We can have nice interview days where we get to meet everyone and they get to meet each other, and we can show off our program. And then it's just nice and scheduled. And I realize, I've had some applicants share with me that it's, they would have liked if they could have, before they even went into medical school, signed up for their neuro-opt fellowship and know where they're going to be in 2030 or something like that. But, I think that there are more there are more programs than there are US and Canadian trained applicants. So that's message number one. So US and Canadian trained applicants do really well in the match. And so I hope that is somewhat calming. We we understand, the challenges that you have, and that it is scary to not find out until December where you're going in, July. But look back to residency, like it's better than residency is. Neurologists aren't going to find out until mid-March where they're moving in July. And we're also very open to keeping this process to reevaluate and constantly improve it to make sure it's working both for the programs and for the applicants. So please share with people when you get into your neuro-ophthalmology fellowships, if you have some comments, bring them to your director, because all the fellowship directors, we all get together and we make these decisions together. So on that note, John, and I know that Carly and Oral already commented on that, but could you say a little bit about the timeline as it stands?
Yeah, I think I would just be really quick since they did such a wonderful job already kind of going over it. But essentially the application, you're going to submit it during your PGY4 year, usually in the summer. And then you're going to have interviews in the fall. Some are virtual, some are in person, some are hybrid, depending on the program. And then the match gets released in December in terms of where you're going to be that following year. And so that's the process. Again, it's the same that we use for fellowships in ophthalmology. So the ophthalmology residents are well aware. For neurology, as the neurologists have pointed out, it's half a year, 3/4 of a year later. But again, there are more programs than there are applications, at least for applicants for at least the US and Canadian. And so you really have a pick of some amazing programs. And we're definitely eager to getting a chance to tell you about our programs. I think the match actually is a big plus for the applicants because you get a chance to see a whole host of programs and decide where you want to be. Whereas in the old system, you almost had to, the first program you interview as, you almost had to take it or leave it. It was kind of stressful. But now you get to see all the programs and really kind of decide one that fits for you.
Well, thank you guys so much. And you don't have to hear from me again. So have a lovely rest of the webinar.
Thank you so much, Dr. Chen and Dr. Moss, for all of this information to understand the landscape of fellowship training, as well as the SF match process. Is definitely extremely helpful to all of us. And now we'd like to transition into the early years of practice, and it gives me great pleasure to introduce Nagar Moheb, who's a neuro-ophthalmologist at Lehigh Valley Fleming Neuroscience Institute, as well as Douglas Snyder, a neuro-ophthalmologist at the University of Wisconsin School of Medicine. And so you please join us and let us know how your transition to the early years of practice has been.
Of course. Hi, everyone. Thank you for the introduction and thanks for having us. So I'm just going to jump into it and ask Doug, how did you decide private versus academia?
Well, yes, thank you everyone for the invitation. Nagar, I picked academic practice because I was really interested in kind of one of my, neuro-ophthalmology, I think, is one of the things that many residents and medical students that end up picking neuro-ophthalmology will say that they very much enjoy their neuro-ophthalmology experience, and that's kind of what drove them to the field. So I wanted to help make that connection. I also have interest in quality improvement. It's kind of one of the niche areas that have been discussed. Sometimes neuro-ophthalmologists have and had interest in kind of pursuing that passion at an academic place. What about yourself?
So I am neurology trained, neuro-ophthalmologist. So I enjoyed the hybrid environment during the residency. So we are part of this large hospital network and associated multidisciplinary clinics, outpatient. And so when I was just looking for a job, I was looking for somewhere that I have the opportunity to work with medical students and residents and fellows and have enough resources if I want to do research, while I can keep my main focus on just clinical practice and taking care of patients. So I also wanted to keep my neurology skills up to date. So this way I get to work on inpatient general neurology every 2 to 3 months for a week. So I eventually ended up picking a similar, we came back to our residency program. So I picked a similar hybrid, both inpatient, outpatient, multidisciplinary clinic. But if I didn't have the option to do so, I would have definitely went with academia because as a new attending, I can never imagine myself in private practice, just not having the support of my colleagues early on. So that would have been academia. It's been enjoyable to just knock on the door of the colleagues in the office and ask or discuss the complicated cases, especially when you're a new attending.
Yeah, I certainly agree with that point exactly. It's just great to have colleagues that are helpful.
Yeah. So how did you find your job?
So, job selection is interesting. I think one of the things I just wanted to highlight when I saw that this was one of the areas we discussed is that I think the job market for a neuro-ophthalmologist is great. So if you're looking for an opportunity in ophthalmology or neuro-ophthalmology, this is it. I mean, you are sought after, and I think that there's a lot of places that would benefit from having a neuro-ophthalmologist, both in a teaching sense, but also for patient care. And for me, I had looked at available postings. NANOS has a list of available postings online, and then there's other websites that will offer word of mouth and networking. One of the other things that happens at NANOS every year is usually there's a bulletin board where everybody posts some position that they have. But on the whole, the community is in need of more neuro-ophthalmologists, and so that's kind of was how I started my approach. So I interviewed at multiple places and came to select being up here at the University of Wisconsin-Madison. It's been a great experience here. Just fit well for me, especially with the QI niche. What about yourself?
So same as you. There's a shortage for neuro-ophthalmologists nationwide, and during residency, I was just noticing we are in a location that we're about 50 miles away from Philly and 90 miles from New York. So our patients, especially the ones that needed regular follow-ups, like an IH patient, they had to drive at least an hour or even more. Like right now, we get patients that are driving hour or two to reach us. So there was a lot of access issue for patients. And so I basically walked to my department chairman's office, knocked on the door, and told him that both me and my husband, who's also a neuro-ophthalmologist, we are interested to coming back and starting our own clinic within the neurology department. So he was very interested. We got excited, started working on it. Basically talked about the contract and what we need to start with, and the machines and the rooms and techs and all of that within a few weeks. And so I signed my contract before I left for fellowship. So they had about a year or more to kind of take care of everything that were needed to start, which can be challenging. So if anyone, especially just starting a clinic from scratch in a department that never had any neuro-ophthalmologists close by. So it's very important to have a supportive chair or clinic practice kind of manager, whoever is responsible for it, to be supportive and interested in the success of the clinic that you're starting. So that was one, but it's very rewarding to actually build something.
What would you say is the favorite thing, about your current position, about this current job? It sounds, it was kind of created a bit.
I love it. It's like there's not a dull day in neuro-op clinic. You get to enter in your clinic and you see a stroke patient, and then you see an IH patient, then ocular myasthenia, then a Parkinson's, then MS patient. So it's just always a challenge, and you get those mystery cases on a weekly basis, and you're always excited. So there's never a boring moment in neuro-op clinic. The other thing that I love is that we generally as neuro-ophthalmologists, we talk to a lot of our colleagues in different departments, from neuroradiology and IR to oncology, neurosurgery, and rheumatology. And it's nice that you feel valued by your peers every single day. And it's very important for the patient care. And at the end of the day, we all put everything together and come up with a treatment plan that works best for the patients. So yeah, that's why I really love it and I enjoy it every day.
Yeah. I mean, it sounds that's exactly kind of one of the things that I like about the position is that you see things and you have the opportunity to care for patients that, you're the person who is kind of solving the big mystery. And it's really rewarding.
Yeah.
And also, I think, you see things that you only read about. And I think, the funniest thing is coming into practice now, doing this for about 2 years. I remember thinking, going through residency, okay, boy, I've seen a lot. And then getting to fellowship and thinking, boy, I didn't see anything. And then thinking after fellowship, boy, I've seen a lot. And then getting into my first 2 years and thinking, oh my goodness, I didn't see any of this, and it's just really a enjoyable field because you continue to learn and have to adapt as kind of more knowledge comes out. And so, I think that that's one thing. I mean, I also have, to echo your support, it sounds like you have a very supportive chair. I would say that that's something I really like is that I have a very supportive chair and also some very supportive colleagues and staff here. And one of the things is that I think, neuro-ophthalmology, as kind of referenced before, is you can make your own path. I have a dual practice. So I decided, similar to you, that I didn't want to lose my I wanted to practice and exercise my ophthalmology skills that I had spent 3 years learning. And so I have a nice setup that was worked out well here where I have about 2.5 days of a comprehensive practice and then about 2 days of neuro-op practice and then a half day of academic time. And that has really allowed me to kind of do both. And it is nice. And I also will do strabismus surgery to reference points previously trained. I had a fellowship that had a great, robust strabismus exposure. And so I look at that as the equivalent to the double vision neuro-ophthalmology practices, diagnosing and then treating. So that's been a really a great thing. And I just want to share that with, those medical students or residents that are thinking about neuro-ophthalmology. One of the big myths, let's just dispel, is that you can do surgery and you can have a very rewarding surgical experience. If you don't want to do surgery, that's fine too. But I just think that that's something to cover. Is there anything you would have liked to know before you got into your current position? I mean, it sounds like you kind of knew the situation well, but anything you wish you would have known
I wish
before?
I had more time to learn ophthalmology, to be honest with you. It's like the 1 year of fellowship for neurology trained neuro-ophthalmologists, it's enough for you to recognize all the emergencies and know who to send the patients to. But that's one thing that I wish we had time. But no matter how I think about it, other than doing away rotations or electives, there's nothing else that you can do. But it's like a learning process every day. You see something, you read about it, you ask your co-fellows from fellowship and send them pictures of the retina and ask them questions, and you learn. What about you? Was there anything that you wish you knew before getting to your position?
Yeah, I think that's a great point. I mean, I would have said I would have loved to spend more time with EMG and those sorts of things. It's just not an exposure that you get. But I think it recognizes how important it is to have a dialogue with your either your neurology or neurosurgery colleagues who might be able to help. I actually just had that a patient. We were thinking about testing from myasthenia with a single fiber EMG, and the question came up, what about the Botox? I had no idea. So I had to, ask our neurologist who reads the EMGs. And so, I think that there's always going to be that thing, but I think that's, yeah, I think to maybe highlight that point, I would have wished maybe I would have known how much I wouldn't have known, and realize that as you kind of go about your career. But I think that's just what we do, is I think we have to sort out the mysteries, and sometimes I'm just left telling the patient, I don't have anything here for you, but we're going to keep thinking about it and go from there.
Yeah,
Yeah. But yeah.
all right.
Well, thank you both so much. I really appreciate all the advice that you provided on the early years of practice. And we're going to transition a little bit into the Q&A. So I'm certain we're going to call on you a little bit more for some more information. Rafi, why don't you take it away?
Yeah, great session so far. A lot of questions that have come in the pre-session registration were answered. One of them that came up, though, is about surgery. And for our fellowship directors, what are some examples of programs that teach orbital surgery? And in general, are there other examples that teach strabismus surgery? You don't have to go down the whole list of them, but what could you give us as some examples of places that do that? And additionally, for those who are interested in doing cataract surgery, general ophthalmology, I did some cataract surgery early in my fellowship. What are some places where you could potentially do that? If you could share that with our audience.
Maybe I can talk about that first. So in terms of strabismus surgery, I think there's a very large group of programs that do strabismus surgery. And again, it's not mandatory, but I know some groups are, like UCLA, they do strab, Penn. I think the Mass Pioneer group does, University of Minnesota. There's a whole host of other ones too. In terms of orbit, I think the numbers programs are a little bit less. I know Oklahoma does orbit, Colorado. I think Wales has a program that does orbit. And again, there's probably others as well. And so essentially just kind of reaching out to, looking at the list, talking to fellowship directors, and your mentors can guide you too.
Just to add to that, I did my training at University of Utah, and that option is still available there as well. All right.
And again, these fellowships are smaller. There's a lot of flexibility. If I've got a person who wants to do cataract surgery, then we often will figure out a way. Again, these are small enough programs. There's flexibility. That's a nice thing about these fellowships.
For Oral and Carly, you did a great job summarizing your experiences and what it takes to be interested in neuro-ophthalmology. For you again, Heather and John, and maybe Carly and Oral, you can talk about what you think you're doing to do this as well. What are the important factors for securing a neuro-op fellowship? What are you looking for as a fellowship director and an applicant to your program?
I would say for us, number one is interest in neuro-ophthalmology, which presumably you already have because you're applying to neuro-ophthalmology fellowship. And yeah, we are, interested in, someone who's, sort of inquisitive, wants to learn. We have our fellows do a research project. It's not onerous, but someone who has some interest in doing that. But I would say we don't have a lot of preconceived notions about what we want in our fellow. What we want to do is take a bright person who's interested in neuro-ophthalmology and help teach them a little bit more and guide them, and then launch them to improve our field.
Okay, there's a question from the chat. What advice would you give to a second-year medical student seeking mentorship in neuro-ophthalmology? My university doesn't have a dedicated department for ophthalmology, so I'd love some advice on outside sources or individuals within NANOS. Nailing, do you want to take that one?
Sure, absolutely. And I think Carly touched on this a little bit because she mentioned that her institution didn't have as robust a neuro-ophthalmology program. So I think the key is certainly seeking out mentors. As I mentioned before, we're going to have a survey at the end that has a QR code. You have the opportunity to actually get connected with a neuro-ophthalmology mentor at the end of this webinar. So please provide your information and we can connect you with one. Also, It's just emailing anybody that's a neuro-ophthalmologist that you're interested in getting to know, seeking advice from, and certainly coming to NANOS. We have a great community of wonderful colleagues. We want to get to know you. There's a lot of programming at the meeting that's geared towards getting to know the trainees and interacting and networking with each other. And so that's one of the best ways to get to know neuro-ophthalmologists outside of your own institution.
All right.
Yeah.
So we're gonna go ahead.
I was just going to add to that, Dr. Rasul, and just encourage you as a medical student not to be afraid to reach out to people, network as much as you can, ask questions. You may find that someone knows someone who knows someone in your community that does neuro-ophthalmology, and they might not be related to your institution, but they could help connect you.
It's a great discussion. We're going to transition back into the next session so we can stay on time and answer more questions as we move on. In our next part of the session, we have Doctors Ann Coleman and Dr. Stephen Galletta. Dr. Coleman is the Bradley R. Stratzma, MD, Endowed Chair in Ophthalmology and the Chair and Executive Medical Director at the UCLA Ophthalmology Department. And Dr. Galletta is the Philip K. Moskowitz, MD, Professor and Chair of the Department of Neurology at the NYU Grossman School of Medicine. We are honored and excited to have you share your unique and important perspectives on the value and importance of neuro-ophthalmology to the academic department and practice setting as leaders of departments yourself. So jump right into it. We'll start having you tell us a bit about your backgrounds and departments and what neuro-ophthalmology looks like at your institution.
So I'm Dr. Coleman. I'm an ophthalmologist, glaucoma specialist. So in terms of our institution, we had 5 neuro-ophthalmologists. 3 were in the Stein Eye Institute. And then when the Doheny Eye Institute joined UCLA and helped create the Doheny Eye Centers, we got 2 more, both Peter Quiros and Alfredo Sadoun, who joined Lynn Gordon, Laura Bonelli, and Tony Arnold. Lynn Gordon retired, and then we recruited Alex Fine, and he was the first neurologist that we've had in neuro-ophthalmology. Everybody else was ophthalmologist. And then we're now recruiting another neuro-ophthalmologist. In terms of surgery, prior to the recruitment of Peter Quiros, to the Doheny Eye Centers, UCLA, from Doheny Eye Institute when I was with USC, we didn't have neuro-ophthalmologists that operated. And so having Peter operate has brought in some interesting dimensions in terms of handling adult strabismus in our department, which has been great. And so that's one of the advantages of having an ophthalmologist who's a neuro-ophthalmologist, although that hasn't been the majority of the individuals in the Department of Neuro-Ophthalmology have not been surgeons. So, Steve?
Yeah, hi, Steve Galletta. Welcome to everybody here. I am a neurologist, trained neuro-ophthalmologist, former neurology program director and neuro-ophthalmology director at Penn, where Heather Morse was a star resident and then fellow. And then my prior head trauma got the best of me and I became a chair, and I'm the chair of neurology at NYU. At NYU, we have 10 neuro-ophthalmologists. 8 of us are neurologists by background, and 2 are ophthalmologists. Even though we span separate departments, we function as one division. Of course, the ophthalmologists may see more problems on the afferent side or the optic nerve side, while the neurologists see a lot of efferent problems. We have joint conferences. We share the education of medical students, ophthalmology and neurology residents. Some of us do administration, some do research, all of us do education, all of us do clinical work to varying degrees. Some operate. Most of us are outpatient based. but some of the group do a lot of inpatient work.
Awesome. We spoke about some of the clinical activities that neuro-ophthalmologists do from the medical and surgical side. Can you talk a bit about the importance that we bring in terms of research endeavors in the department, and then moving on, some of the financial benefit of a neuro-ophthalmologist in your department and practice?
For the research endeavors, it's like all faculty in a department of ophthalmology in a school of medicine. We're very interested in their having a research interest or educational interest or some type of creative work. And so I think that that's what draws individuals into academics. Is that they do have a desire to do creative work where it's supported at some level in terms of the faculty. And I think for the neuro-ophthalmologists, they have the opportunity to participate in large trials, such as Stacy Pinelli's is a pediatric ophthalmologist, neuro-ophthalmologist who runs PEDIG. And so, that's gotten her involved. Tony Arnold was involved with a lot of the large optic nerve trials. And so I think, there's many different opportunities. The individual we just recruited is interested in lab work, combining that with neuro-ophthalmology and also strabismus surgery. And so I think what I'm gaining from this webinar is it's great to be a neuro-ophthalmologist, either ophthalmology or neurology trained, because it gives you a lot of options. And I think Dr. Galetta is going to go over the finances and also some of the research, but since I'm here, I just think it's really important to have a neuro-ophthalmologist in departments of ophthalmology. I think that when patients come a lot of times with neuro-ophthalmological complaints, they're ophthalmic complaints. They end in front of the ophthalmologist. And so the ophthalmologist has to know how to at least handle it initially. Is this an emergency? Can I walk down the hall and get Tony Arnold or Peter Kuros to come help me with this patient? It's more complicated. And so I think it's extremely important to have neuro-ophthalmology training in our residencies. And then Dr. Galetta and I had a great time chatting about this webinar, so I'll let him provide his ideas about the finances and research and clinical activities.
Yeah, absolutely. Clinically, neuro-ophthalmology brings great insight to the hardest part of the examination. And your patients and your colleagues are forever grateful for you solving some of the most complex mysteries of all of neurology and ophthalmology. And the great thing about neuro-ophthalmology is that it gives you a second chance to make a diagnosis. We're always taught the history is important, and it is tremendously important in neuro-ophthalmology, but the exam is really, really important too. And so you get a second chance to make a diagnosis. And if you love neuro-ophthalmology, anatomy, you'll love neuro-ophthalmology. Now, in terms of money, there is a thing called downstream revenue. And what does that mean? That means that the medical center makes money from the services you order, like an MRI, or if you order an infusion or labs, your institution can make a lot of money. And that can also be very valuable to you, because then you might be able to request some support for the role and the complex patients that you're seeing. So let me just give you an example that somebody who does, MS, and I did a lot of MS work early in my career, those neurologists can potentially bring in $5 to $10 million per neurologist to the institution. And so that downstream revenue can be very, very valuable to you and to your institution. In terms of research, just very quickly on research, yes, you can get NIH funding. We have an NIH-funded neuro-ophthalmologist now, and she's been a funded investigator for a long time. Right now, she's working on a new type of OCT machine and neurodegeneration. Very exciting. But you can get involved in clinical trials. And we got involved in MS clinical trials early in our career. We might have been just examining the patients, but we said, hey, why don't you put vision into the studies? And we got the investigators to agree. And so we did an investigator-initiated study, which not only buys you time to do it, but also maybe advance the field. So lots of opportunities from a research perspective as well.
Awesome. And my final question for you is, neuro-ophthalmologists often hold educational, teaching, leadership roles, administrative roles in ophthalmology. What can you speak to your experience with that in your departments, and maybe what your departments would look like without a neuro-ophthalmologist? Can you imagine what life would be like without us?
First of all, we'd be crying our eyes out if we didn't have neuro-ophthalmologists. And neuro-ophthalmologists are natural for educational opportunities. And I was fortunate to be able to be a program director, to be a fellowship director, to be a dean of admissions for Penn's Medical School, largely because of the connections that I made as a neuro-ophthalmologist with all the various subspecialties that it crosses. And at that time, it didn't pay a dime. When I first started out, none of these jobs paid a dime, but they were the most rewarding jobs in all of medicine, and they still are. Today, I'll just give you an example about a program director in neurology. A program director in neurology will get 20% of their salary as a base, and then 1% for each resident in the program. So if you have 30 residents total in your program, you will have 50% of your effort paid by the GME office. Okay, so that is phenomenal. So not only do you get to teach because you're a natural at teaching the exam, but you'll also get maybe half of your effort paid for. Now, if you're not the program director, you can't get that job, be an associate program director. You get about 10% effort for that. So you could get effort for all these roles in education that can make your life so much more fulfilling and rewarding.
Wonderful. All right.
Yeah, and I agree with that, that about how being a neuro-ophthalmologist really connects you with the rest of medicine. I think as a glaucoma specialist, we're much more insular and we tend to be more within the ophthalmology realm. And I do think the neuro-ophthalmologists have an opportunity to get more involved in the hospital and then with other specialties in medicine. So I think that's a positive because I think sometimes we get too isolated as ophthalmologists.
Wonderful.
Yeah, and that's a really cool thing is that you can be predominantly an inpatient doctor in neuro-ophthalmology. You just need to connect with neurosurgery or the emergency room or ENT, and they will consult you. There have been neuro-ophthalmologists that have made their careers doing just inpatient work, and I know how people like to do that. But for many of us, it's outpatient.
Awesome. Well, thank you so much for your perspective. It was wonderful talking to you and learning about the importance of neuro-ophthalmology in the academic medical center and departments. And I'm sure we'll have many questions about that either here or offline for you as we continue on this webinar. So thank you very much.
Thank you. Sorry that I can't stay. Really have enjoyed it. So
awesome.
Thank you. Bye.
Thank you. In our next part of this session, we're going to be joined by Dr. Ellen Mitchell and Dr. Bonnie Kyung. Dr. Mitchell is a pediatric ophthalmologist, neuro-ophthalmologist who is in Atlanta practicing with the Thomas Eye Group. And Dr. Kyung is a neurology-trained neuro-ophthalmologist who practices with the Swedish Neuroscience Institute in Seattle, Washington. We are really excited to have you share your important experiences and perspectives from the private practice world of neuro-ophthalmologists. Of neuro-ophthalmology. So Start with you, Dr. Mitchell. Please tell us a bit about your background, why you chose to enter private practice, and how you chose where you're working currently.
All right. So, hi, everyone. So as Dr. Adeshina said, I am a pediatric ophthalmologist and a neuro-ophthalmologist. I actually had my feet in both worlds. I was in academic medicine for 10 years prior to entering private practice. I did my neuro-ophthalmology fellowship in Boston and did a pediatric fellowship, ophthalmology fellowship in Pittsburgh, and stayed at the University of Pittsburgh and practiced at the Children's Hospital of Pittsburgh for 10 years. And then my husband had a career opportunity that caused us to have to relocate to Atlanta, Georgia. And I ended up in private practice here. I wasn't necessarily looking for a private practice position. I was considering academics as well. But the private practice situation actually worked out best for my family and the flexibility that we needed. And because I still have young children and my husband's new job requires a lot of travel. And so I needed to have that flexibility. And so that's one of the reasons that was a good fit. And also living in Atlanta, where we ended up purchasing a home, I needed to be able to not have to be in traffic for an hour. So that was important too.
Bonnie?
Yeah, thank you for inviting me to speak on behalf of the private practice cohort. So after completing fellowship at the University of Utah, as a newly minted neurology trained neuro-ophthalmologist, I was convinced that I needed to continue with academic medicine. And I met this really nice neuro-ophthalmologist at the NANOS banquet. His name was Jorge Cata, and he hired me on as a neuro-ophthalmologist at the University of Illinois in Peoria. So I enjoyed getting my feet wet in the world of neuro-ophthalmology in central Illinois. And I was also able to see inpatient neurology patients as a neurohospitalist with a team of excellent neurology residents. Then after 2 years, my husband's job was still stationed in Seattle, and our desire was to come back to Seattle. At the same time, Eugene May and Steve Hamilton, they were private practice neuro-ophthalmologists, and make note that they were standalone office, which is very unique. And they had just been acquired by Swedish Neuroscience Institute. And since they were in transition themselves, they didn't know if they could bring me on board. But we still wanted to go back to Seattle. And so I took on the full-time neurohospitalist position at Swedish, which lasted about a year. And then it became abundantly clear that I wasn't happy giving TPA and running stroke codes at a level 1 stroke center. There were fun parts about it, but I wasn't very happy. So ultimately, I was fortunate to start working part-time in the neuro-ophthalmology clinic at Swedish, which is part of a large Providence network in Washington State. And so our group consists of a large neurosurgical group and all the subspecialties of neurology. So after about 10 years, Steve Hamilton has retired, which created this large vacuum and need for me to step in, but I decided to stay part-time. And luckily I have 2 other partners, Stu Sinoff and Eve Feinberg, and I work 2 days a week and then take care of my kids the rest of the time.
Okay. So having had feet both in the academic and now private side, what is your scope of practice like comparing, academic to private, and what does a typical work week look like for you? You mentioned a little bit about it already, Bonnie, but Ellen, what's your comparison between private and academic and your week?
Okay, so my typical week, I work 4 days a week, and I see pediatric patients, like general pediatric ophthalmology patients, 2 full days, and then I have a half day of neuro-ophthalmology clinic, and then the rest of the day is pediatric ophthalmology, and then I also do a day of ROP. And so that's how my schedule, my 4 days a week breaks down. I do operate. I operate 1.5 days a month, sometimes more, depends on, how busy things are. But I'm typically in the OR 1 full day and another half day a month.
Why?
Yeah, as you can imagine, as a neurology trained neuro-ophthalmologist, I don't do any surgeries. And all three of us in clinic are salaried, so we don't follow RVU models of compensation. And it's about 60 minutes allotted for a brand new patient, and then 30 minutes allotted for follow-up. And this remains the same amount of time, 30 minutes for virtual follow-ups. And my virtual follow-ups are mostly ocular myasthenia gravis well maintained on immunosuppression, and who I check in on every 6 months. For instance, we might even see Alaska Medicare patients in virtual follow-up if they're very stable.
And how does your experience in private practice compare to academia? Are you taking call in private practice? Any inpatient care anymore for you, Bonnie? Do you ever see inpatients at all other than ROP, Ellen?
Yeah, so I do take call. So I have privileges at the Children's Hospital of Atlanta, and so I take call with a call group of other private pediatric ophthalmologists in Atlanta, and so I'm on call once every 8 to 9 weeks for 7 days at a time, and I no longer have residents. And so the call is painful, but it's hit or miss. Sometimes it's rough, other times it's not so bad. But the call is, I'm first call. There is no one ahead of me to be called. So I do see inpatients, and inpatient consults. It can be neuro related, but it can be trauma, pediatric ocular trauma. It could be general pediatric ophthalmology stuff like, orbital cellulitis, that sort of stuff. I do take practice call as well, but that doesn't require me to just answering patient phone calls. And that's maybe once every 5-6 weeks.
Okay.
So we mostly bring stable inpatients to our outpatient office, which is the building right next to the hospital, as long as our nurse is available, or if the hospital has a nurse that can accompany the patient. And so those circumstances are usually neurosurgery asking us to see a case emergently before they take the patient to the OR. I don't think I normally go to the bedside. I can count on my hand the times I've gone into the hospital for a neuro-ophthalmology question. And as for call, the three of us share calls every third week. I'm on call after hours for the entire week. I think it's pretty nice because it's usually on the weekend somebody's calling for like a refill of Diamox, or it could be the ER asking us to see a double vision patient that they've like pretty much fully worked up from an imaging standpoint, and they want us to see that patient as soon as we can, or just the ER asking for guidance on a case.
Okay.
We don't take the group neurology call, and I'm glad that they gave us that option. We would be on call less if we took the group neurology call, but then I would be called about potentially epilepsy care in the middle of the night. So I feel fortunate to stick with pretty focused neuro-ophthalmology questions.
All right. As we wrap up our conversation, what do you love most about your practice, and what advice would you give somebody who was considering private practice neuro-ophthalmology career?
I would say that I love the flexibility and I guess the autonomy. I have a little bit more that I did not have in academic practice. I control my schedule. Before I started the job, we sat down and looked at, okay, this is the template that I would like. This is the schedule that I want. And the second part of your question is, what advice would you give for someone considering private practice? I would say, don't hesitate to ask for help. As far as asking for someone to help you negotiate, make sure you negotiate. I ended up getting a lawyer to look at my contracts and help me negotiate, because I've never really gone through a negotiation process. I mean, my first job was in academics was straight from fellowship. Where I did my PEDS fellowship, I went to work and coming from fellowship to being an attending, I was just happy to get a paycheck, you know? And so I did not negotiate. But yeah, make sure you negotiate, know your worth. And one of the things that was helpful for me is that, you know, the lawyer that I hired knew the data, knew what I should be making as a, you know, working 4 days a week as a pediatric ophthalmologist, neuro-ophthalmologist, and he was able to use that to help me negotiate. So
Awesome. Money?
So what I love about, I think I would agree with the flexibility aspect of things. And one thing I missed talking about was that I do spend a chunk of my lunch reviewing referrals, and I don't know if providers in academic medicine have the opportunity to do that. I think I review about 20 referrals while eating lunch, but I like to kind of keep that, I don't know what the word is, but like kind of control, and being able to go through all the referrals, even though it can take up some time, and figure out which patients we can help out the most, or which patients our team can help out the most. So I like that flexibility, and also being integral in making my team. So I think hands down, the support that I get from my front desk to my patient coordinator, who was able to get an MRI on my patient the same day today, and my 3 techs, and then most importantly, my nurse, kind of make me feel fully supported. And one of the benefits of my group is that if my nurse isn't there, the MS nurses can help and cover, and they just triage all my chart messages and fill out my forms, and then kind of like put a sticker for me to sign it. They arrange for send out labs, and we have patients can have a phlebotomist from Mayo Clinic go to their house and draw those send out labs. So it's just nice to be part of that kind of planning to make things streamlined for patients and to have that full support every day.
All right. Well, thank you so much for your perspective. Great talking to you, and thanks for joining us. We're going to switch to our last Q&A session, just a few minutes to address questions from the chat and from the pre-submitted questions. Naileen, what do you have for us in this session?
I'll just start this off. Maybe this can be directed at Dr. Moss and Dr. Chen to begin with. There's a number of questions about international applicants or Canadian trained applicants applying for fellowship programs. And so do you have any advice for them?
Certainly. So I'm a stealth Canadian. I happen to do my medical training in the US, and Dr. Rasool is also less stealth Canadian, but she did about half her training in the US. So it's very fellowship program dependent, and a lot of that depends on the licensure of the state that you're applying to and any institutional GME requirements. So generally for Canadian applicants, it's fairly straightforward. When you've completed your neurology or ophthalmology residency, you apply. If the institution is able to sponsor a J1 visa, that's generally all that you need. There are some other visas that then you would need your USMLE step 1, 2, and 3, but like our current fellow is Canadian and from Sherbrooke, Quebec, and she does not have her USMLEs, and she's here on a J1 visa, and everything is going swimmingly. For applicants who are internationally residency trained, I would say look at the program descriptions to make sure you don't waste your time applying to programs that can't credential you. So, for example, at Stanford in California, we can only credential people that are eligible for a full license in California. And unfortunately, you need 2 years of ACGME training in the US to do that. And so if all of your training has been overseas, even if you have ophthalmology and neurology fellowships, if they aren't ACGME training, then unfortunately our institution won't let us consider those applications. We're very clear about that on our program listing.
Yeah, and on the program listings, you know, there's going to be like 3 or 4 things at the very top for all the program listings. And one of them is that question, do we take international grads? And so again, that should be listed on every single program right at the top.
One question that came from the chat, and for those medical students that are out there wanting to know, I want to be an ophthalmologist eventually, should I do neurology first or should I do ophthalmology first before I become a neuro-ophthalmologist eventually? We have our biases, obviously, but what would you generally give somebody advice who wants to be an ophthalmologist eventually, but is not sure which pathway to choose?
Yeah, I can try that one. I think if you like complex cases and you like inpatient medicine, then neurology would be a good calling. If you like to take care of patients with MS or myasthenia, those would be some reasons to be a neurologist. If you want to do surgery or you like the optic nerve in particular, like those cases, then ophthalmology would be a good way to go.
One last question. Interesting question. If you're doing neuro-ophthalmology and plan to work in a rural area where neuroimaging is maybe difficult to obtain, is it still worth being a neuro-ophthalmologist?
Yes, because you're better than an MRI scan. And that's been proven time and time again, okay? If you can examine and look for the optic nerve, you can beat the MRI, and certainly you beat it in the brainstem.
Awesome. All right, that's it for our session. We're going to turn over to Amy to close us out with a home run.
Hopefully. All right, can I get the slides? So I just have a few slides to talk about getting involved in neuro-ophthalmology. Next slide. So first and foremost, there are some really amazing resources out there. I will tell you that neuro-ophthalmologists love to make resources. And so we have a treasure trove of amazing things to check out. So first and foremost, we have Dr. Adeshina's podcast, Out of the Blind Spot. You can find this on Apple, on Spotify, and they're a great set of discussions with neuro-ophthalmologists across the country and Canada, talking about neuro-ophthalmology and the amazing experiences and opportunities available. Also, there's the upfront cases that were crafted by Dr. Larry Froman in collaboration with neuro-ophthalmologists, again, throughout the NANOS community to identify cases that are particularly interesting and highlight the amazing cases that we see in neuro-ophthalmology. Make sure to check out the North American Neuro-Ophthalmology Society webpage. There is a ton of really great information. We've just rolled out a brand new medical student information page with a lot of resources on it, as well as the Yono portal that has been on there for a nice long time, but again, has a lot of resources for people to review. Also, you can become a student or trainee member of NANOS, which is a great opportunity to be on our wait list, or on our, not on wait list, on our listservs and to learn more about NANOS and what's going on, about meetings, about upcoming events, and to make connections. Also, the novel library has been published by the North American Neuro-Ophthalmology Society and actually has a page of resources available within there, the Neuro-Ophthalmology Virtual Education Library page that can be found at the QR code that's here. And then finally, we have a lot of opportunities to come meet us in person. So the NANOS has an annual meeting. This year it'll be in Tucson in March, but we have a meeting in 2026 in Boston in March and in 2027 in San Diego in March. So they're a great meeting. It's always a great meeting, as everyone here has mentioned already. It's a great opportunity to learn a lot more about neuro-ophthalmology and to meet everybody. There are members who are involved in AAN and AAO, and in particular, AAN is coming up, and we will have a cohort of neuro-ophthalmologists available at the trainee forum. and at the Medical Student Symposium that will be happy to talk with you if you are attending that meeting. Also, AAO typically has some representation. And then there's the AAMC Virtual Specialty Forum, and we'll have a group of people participating in a booth there. That's on April 4th. Actually, this is the wrong date, April 4th in the evening. There's much more information on the AAMC webpage about that. I want to say a really, really big thank you to our group, all of these amazing physicians who took time out of their day to come and help us out. Thank you to my co-chairs, Dr. Adeshina and Dr. Razul, and also to my co-chair in the pipeline committee, Dr. Falardeau, who helped us out as well. A big thank you to the NANOS Executive Office and Toma Kinville-Asian, who helped us out a great deal in making sure we had everything we needed today. So last but not least, please connect with us. There will be a survey that goes out at the end once we finish here. This is also the QR code for our feedback. Sign up and get a neuro-ophthalmology mentor. If you fill this out, we will connect you with someone to learn more about neuro-ophthalmology and make a connection ASAP so that you can feel like you're a part of the community as well. We really appreciate your feedback, and thank you so much for joining us today.